What causes hand tingling and how can we help? So hand tingling can be caused by a few functional or structural irritations. So we've all heard of carpal tunnel. That's one cause of tingling in the hands. We could have a thing called thoracic outlet syndrome, where you get a compression of the nerves and the blood vessels sometimes up around the outlet of the thorax or the neck, which supplies all the nerves that run down the hands. We can also have dysfunction around the cervical spine, and that can cause tingling in the hands. So a lot of hand tingling can be produced up the top near the neck where a lot of those nerves exit, but also it can be local, such as carpal tunnel. And other simple things, so we can have postural dysfunction. So we've all been on a tablet or a device for too long, maybe laying in bed on our pillow with our hands up, and that can cause tingling in the hands. So it's not always caused from something of a condition, so like carpal tunnel, or it's not always caused by a problem such as thoracic outlet syndrome or even a disc problem up in the neck. It can be caused by simple biomechanical dysfunction. So when we're assessing someone with tingling in the hands, we want to make sure of the origin of it. So we will run through a physical exam. Firstly, we'll ask the patient when they feel it, where they feel it. We might do some orthopedic testing and some neuro testing in the wrist or up in the shoulders. So we might test for thoracic outlet syndrome. We might do Tinel's tap on the carpal tunnel to see if that reproduces any symptoms. We'll also do movement and orthopedic assessment around the elbow and the wrist, as well as the shoulder and the cervical spine, just to determine where that tingling in the hand is coming from. And obviously the patient's history is an important point as well. So they may only feel it at night time, they might feel it when they're sitting at their desk, they might feel it when they cough and sneeze. So that always gives us a clue of where it's coming from and how we're going to treat it. Obviously, we could refer out if necessary for imaging, such as MRI or just plain film radiography, to have a look at their neck if we think it's coming from there. We can do things such as nerve conduction studies, so we might send them to a neurologist if we can't determine where it's coming from, or we think it's more of an impingement that needs a neurological intervention. So in that case, we'd refer out for a neurologist to actually have an assessment of that. So once we've assessed where it's from, and if we've had to refer the patient on, got those results back from a nerve conduction test, we'll then work out how we're going to treat it. So again, typically we'd be looking at doing mobilizations around the thoracic spine, if that's where it was coming from, around the cervical spine and restoring function through there, doing mobilizations through the wrist, doing some muscle work in and around the elbow to restore that function. We would look at using techniques such as needling, kinesiotaping, cold laser, shockwave therapy. We'd be giving the patient stretches and rehabilitation exercises to do at home. Typically, again, with orthopedic tissue healing and muscle function, we'd be looking between 4 weeks to 8 weeks to actually have a reduction in pain and symptoms. Typically, we'd actually see pain reduce a lot faster than that time frame.